full body activation sequence is designed for you to use on a daily basis to keep the activation process active and making sure that the movement patterns are accurate. We're going to run through the whole sequence today, which will take a little bit longer in this video, but for you on a daily basis should take no more than 5 minutes. You can use your fingers for this, but I've also got here a couple of things that you can use as an activation stick if you find your fingers cannot get into the right places. So we've got, this is a proper activation stick, it's just a tube with a cap on the end, and this is obviously a wooden spoon which you can use the end of the handle. So we're going to start with the most important area for activation, and that is the diaphragm. So in a sitting position like this, I want you to sit tall so that the rib cage can be felt easily without you crumpling. Start at the outside edges with your fingertips just underneath the rib cage, and in small circular movements just work your way underneath the edge of the rib cage towards the centre. Be mindful of any areas which feel particularly tight and hard to the fingertips, or maybe quite tender, and just take a little bit longer on these areas. Work into the centre here where the chest bone comes down. We want to start working our way up the centre of the sternum, and this is in a circular movement or a side to side or an up and down. There will be some quite tender areas on this, so don't be concerned. But what you're trying to do is to achieve a bit of a slide between the skin and the bone. Work your way up to the top where it joins a little crevice here. And from this point then, we're going to focus on one side only. Working underneath the collarbone in that little fleshy dip, right out towards the shoulder. Using the fingertips now to get into the pec tendon. It'll feel quite meaty there, so get hold of that, feel it, and then give it a nice deep rub. Taking it now from the centre, moving with the opposite hand across the same area on the opposite side. Again, be mindful of any tender areas or really fleshy bits that might need a little bit more focus. Use the breathing throughout the whole of this process to try and reduce any stress and to help relax the tissues. Moving on to what we call zone 1, which involves the glutes and the hip flexors. The hip flexor is called the psoas. You need to locate the belly button for this and then find the hip bone at the front. A point midway between the two, going 45-degree angle downwards, is generally where the psoas point is. Another way to find it is to find the belly button, go out an inch and down an inch. Although for larger people, this might be a little bit more than an inch. So finding that area on both sides, you can do these at the same time, or if you're using something like the wooden spoon, you can use it one side and then the other. We are working deep into the flesh, but we are making sure that we are focusing on the resistance coming back at us so you don't go in too deep. Keep breathing throughout. Working now into the glutes. Follow the spine up to the top where it meets the skull, and then using the fingers on either side to rub into that little crevice below the skull and deep into the neck. We work from centre outwards, and again you can use your wooden spoon handle. And again we're trying to get the tissue to slide a little freer from where it is to start. Working out towards the jaw now. So we have the edge of the jaw here. The ear lobe is at that join, and you want to come at it from a back to front direction, again getting into that real deep little crevice. This will generally be quite tender. Zone 1 done. Moving on to zone 2. There are two areas of zone 2, the lower body and the upper body. We're going to try and incorporate these together for quickness. So we're going to start with the quads. The quads have 2 points. The first one we call the Peter Pan point, and that's because Peter Pan tends to stand like this. So with your hands on your waist, you will sit them into that little gap between rib cage and pelvis. This is the area where the first point for quads is located. So go right to the back as far as you can, where it will meet the big lumbar muscles, and work your way all the way through to the front, where it starts to pick up the abdominal muscles. Doing this on both sides. Again, you can do this at the same time if you want to. Now we are moving into the lower quad point. On the inside of the knee, above the knee joint, is a little fleshy teardrop muscle. We're getting underneath that teardrop muscle and we are rubbing away at that tender spot. If you can then extend this from here, working all the way up that tender inner thigh area. This is actually moving on to the abdominals now. So work your way up there, one thigh at a time. Other side again, teardrop muscle, get into that underneath the muscle, start to move the muscle around on the thigh bone. Be mindful of any tenderness and working a little bit longer on those areas. And then working into the abdominal points, working up the inner thigh. For the hamstrings, which are the antagonist muscle group to the quads, we turn around and using the fist, feel for the edge of this sacrum bone, the little triangular bone that's seated at the back of the pelvis. Use your knuckles to start at the bottom and work their way up the edge of that sacrum bone. Then making your way back down for 30 seconds. Using the fist of one hand now, go into the centre of that sacrum and just rub it up and down right through the centre. This is actually for the pelvic floor. Okay, moving on now to the lower leg and the calves and feet. So we go into the abdominal crevice here, starting on one side. Go deep into the groin to start with. So start right down at the bottom into the crease line of the groin, and in a direction towards the hip bone, start palpating behind. Again, this will be quite a tender spot to work on. We are working our way up to the top of the crest of the hip. So feel the edge of that bone. Taking a little bit of time at the top here. And then when we get to the very top part of the hip, we start to circle around it. So if you imagine, here's the front of the hip bone, and we have got the size of a 50p piece around the front of that hip bone. We are going around that 50p piece into the outer part of the hip, circling around, underneath, and back to where you started. So once again on the other side, crease line, start direction towards the opposite hip, work into that crease line inside the hip bone, palpate and work your way up inside that hip bone. At the crest at the top here, imagine that 50p piece, work around that circle. Again, any areas that are particularly tender, take a little bit longer to work on. They will be the ones that need it the most. Fabulous. Okay, we're coming up into the calves now. So the belly button is situated here. If you take your fingers up 45 degrees till you come to the edge of your rib cage, and then a spot halfway between the two is the points we want to work on here. So we are underneath the rib cage. This is the end of the rib cage here, but at 45 degrees out from the belly button. Staying in the same angle, pop your fingers on your belly button and make a V with the hands. Now slide the hands up until the palm is just over the bottom of the rib cage, and then start to circle with the palm of the hand into the edge of the ribs. There will be one very specific little tender spot between about the second rib up, and if you want to use your fingers on this, you can do, although it will be quite tender. So if it's better for you, just use the palm of the hand and rub together in this area. Then taking it up from one side into the side of the rib cage, using the palm again to just rub up through the sides of the ribs here, releasing into the lats and also into the pecs. The other side, from here, take it out to the side, up the lateral border of the rib cage and right into the side of the breast. And then taking it to the back again with the fists, work into the lumbar area, in this big meaty lumbar muscle here. Really get into there and give it a good rub right into the sides, as high up as you can possibly do. And there you have the full body activation sequence. Use this sequence daily, sometimes twice daily if you get the time in the early stages of your program. And as you progress through it and your body starts to accept the movement patterns, it's probably only needed to be addressed once or twice a week.